Hello and welcome to our first EmBODY WELLShop of 2025. I'm very excited to present on this topic because I think there is so much that we can do to have a healthy heart. And I hope that you discover a lot today that you did not know. One thing I will say as we go through is I'm going to throw a lot of information at you. The goal that I have for you is that you take one thing from here that you can do differently tomorrow or as you move forward. Um, don't feel like you have to do them all, and we'll talk about that as we go through. All right. So our agenda today. First, I'm going to talk about the importance of heart health, and then we'll talk about the specific things that I think a lot of people don't know. And there may be some things you do and some things you don't. Maybe you know them all. If you do, then I'm going to enlist you as a co-presenter next time. Um, there's the lifestyle factors, some known and some I think not so known. Um, there are the special considerations for women. And I like to draw attention to this because it's not just for women. It's for, I mean, this is an each one teach one. So this is really about, understanding these things and supporting one another. So again, if half the population it needs special considerations, then it's important that the other half contribute to support, especially when they are the source of the other half. So, and then we're going to talk about screenings because this is really how you'll understand your risk and how important it is for you to really invest in these lifestyle factors. And then again, we're going to talk about how can you leave this with something practical that you can do tomorrow to jumpstart your heart health. All right. With that, why heart health? Heart health, I thought I'd start it with a little fun quote. The worst time to have a heart attack is during a game of charades for obvious reasons. That's not the guess that you want people to have, and you don't want them to continue guessing. And I'll draw you down to the middle graphic that I have or statistic, because according to the American Heart Association, surveys show that awareness that heart disease is the number one killer, and this is globally as well as domestically in the US, has increased from 30%. So only 30% of people were aware in 1990s that it was the number one killer to nearly 50% today. And that actually is different for women, which we'll discuss in a moment. However, recently, especially with the pandemic, et cetera, there's been a stagnation in this awareness, particularly among younger adults and women. So again, we're not increasing in terms of understanding that. So think about it. Half of the people don't know that this is a huge thing that they need to pay attention to. So again, the statistic it's 32% heart disease of all deaths globally. And again, leading cause of death for men, women, and most ethnic groups in the US. And remember, this heart disease and stroke exceed all cancers combined, et cetera. So again, really, really important to focus on heart health. And 50% of adults in some countries, including the US, have at least one major risk factor. So all these reasons to pay attention to what's going on with your heart. So what do you need to know? You need to know about the lifestyle factors, the special considerations, and what screenings, not only what screenings, but how. And specifically, we're going to talk about blood pressure measurement because that is something that unfortunately, even in the doctor's office, is potentially not done appropriately and for accuracy. So I want you to keep in mind with this that, again, it's about small baby steps. Better is better. So there's no, specific target. It's if you have an incremental better, then that's better, right? So it's all about allowing yourself to not get stressed. We'll talk about stress and its role in heart health, but to allow yourself to grow in small ways because better is better. That's my favorite quote. All right, well, let's start with a little question out there, and you can put your answer in the chat. What role do you think family history plays in heart health? And any specifics that you have around that or that you know around that. So what do you know? What do you know about family history and the importance of it in heart health? Anything that you know or have heard or believe? Anybody? Anybody? All right. So we've got an increased risk. So there is certainly a potential for that based on family history, and increased susceptibility to develop issues. So yes, so along the same lines. So your sort of predisposition to potential issues. So does anyone know kind of what, when you're looking at your family history or documenting your family history, what do you need to be looking for? What tells you whether or not you need to kind of be aware of any increased risk or increased susceptibility? Anybody know? Okay. So medications is a question. So we're going to talk about family history. So what about your family history tells you if you have increased risk or increased susceptibility? Do you know? So I'm going to give you a little clue. It's a prior disease. So yes. So first of all, it's what kind of immediacy. So immediate family versus extended family. And then there's prior disease. So prior disease and also based on age, right? So those are kind of the three things is within your immediate family, and immediate family, I mean sort of grandparents, parents, you, uh, have they ever had any prior disease or prior risk factors? We'll talk about blood pressure, cholesterol, et cetera. But also, when did they first experience that? And then if it was heart disease or heart attacks or anything cardiovascular, when did that take place? Anything before 50 suggests that you probably need to make sure, first of all, you definitely need to make sure your doctor knows about it, but you probably need to consider these risks and lifestyle factors and what you can do a little bit more, because that early diagnosis usually means that there is a genetic predisposition, because with aging, we have increased inflammation. There's some natural things that occur with aging. I think I was reading somewhere that there was a quote about the fact that your heart is like a tire, and once you're using it, it's gonna wear out. There's nothing you can do, so you just have to really take care of it, right? So that's what we need to think about. And again, the earlier the diagnosis, particularly before age 50, is what you need to be looking for. Okay, so ask your grandparents, have those conversations. If they're around, ask your parents about your grandparents if they're not. So just want to really emphasize that. Okay, so let's talk about the known lifestyle factors, and we'll see if they're not so known. I'm going to ask you to just throw out factors that you know that may influence your risk. And when I say lifestyle factors, these are things that you have some control over, things within your lifestyle. What kinds of things do you know can affect and can help your heart? All right, we've got diet. Diet is often stress levels. Yes, yes. Activity levels. Yes. Okay. Anything else? So that's three. I'm going to give you a clue that I have six. See if we can name any others. Any others come to mind? All right, you guys are, all right. All right, smoking and alcohol. All right, we got a little that came in from a couple of folks. So yes, that is a risk factor. In fact, yes, I'm pretty sure. Put it on there. Anything else? Sleep. Yes. All right. Great minds are thinking alike. There are some answers that are coming in at the same time. So excellent. All right. So let's go through a couple of them, right? So this is the first one that came up. The first one that came up was diet. And I want to, when I present, I mean, as a coach, I want to make sure that you leave with something practical. So it's not just diet, but there's actually some recommendations. So following a Mediterranean diet can lower, and CVD, when you see that, is cardiovascular disease related mortality by approximately 30%, right? So we're looking to carve this stuff out and really reduce our risk. So what's a Mediterranean diet? Now, I ask that question because people say it all the time and they kind of say, oh, yes, a Mediterranean diet. and oh, some olive oil and some fish. And so I actually have a Mediterranean diet guideline that was used in a study related to not only cardiovascular disease, but other diseases, because the Mediterranean diet has been shown to lower overall cause mortality. So I have the guidelines that they use, which were very specific and prescriptive in terms of how many tablespoons of olive oil a day, how many servings of fish a week, how many servings of legumes a week. So if you're interested in that, you'll have all my contact information and you can reach out to me, because I want to make sure that you're able to act on these recommendations. All right, so that's one. And if anybody has any other suggestions about diet that they've heard or have questions about, please go ahead and put them in. And we're going to focus on some very specific ways that you can act on these things. So physical activity. In case you don't know what the recommendation is for physical activity, it is at least 150 minutes at a moderate intensity per week of aerobic activity, or 75 minutes of vigorous intensity. Does anyone know the difference between moderate and vigorous intensity? How can you tell? What's a really quick sort of test? And for those of you who have been students of mine, you know, I've said this before. So we've heard heart rate. Okay, but what if you don't have a watch? This is something that you can do without any measurement tools, or stopping you know, what if you don't have anything? How would you determine if you're at a moderate versus a vigorous intensity? Ooh, I'm gonna get some of my students. Ah, thank you. Breath to talk. So yes, at a moderate intensity, you can talk, again, very easily, but not sing. A mild intensity, you could talk, you could sing, you could do. A vigorous intensity, you would have difficulty reciting, let's say, the what's the thing that we say in school before the I forget. Any kind of, you know, recitation, you would have trouble with. You would have some halting in your speech, and you wouldn't be able to kind of say a full sentence without taking a breath. That's vigorous. So talk, thank you. Pledge of Allegiance. I could not remember that. So you couldn't say the Pledge of Allegiance without stopping to breathe and taking a breath. So that's the difference between moderate vigor. So 150 minutes of moderate intensity aerobic activity, or 75 minutes, and 2 muscle strengthening sessions per week. And that's where you see the reduced risk of heart disease related mortality, again, by up to 30 to 35%. So we're really notching stuff away when we get to diet and activity. All right. So stress. Someone did mention stress. So we are just checking them off. Stress reduction practices like meditation and yoga, so those mindfulness practices, which have been linked to stress reduction, can reduce the risk of, again, cardiovascular disease mortality by approximately 20 to 30%. So you can see how these things can really start sort of chucking away at any disease risk that you have. Again, the more risk you have based on your family history, the more that you may want to focus on some of these areas. Now, related to stress is kind of your emotional regulation. So emotional support and treatment, particularly for things that are common like depression and anxiety, can reduce your cardiovascular risk, again, by up to 20 to 30%. So we're talking about big chunks. Social connection. So I don't know if you've heard, but there is the Surgeon General had suggested that we have an epidemic of loneliness, right? And loneliness is self-identified. So you identify as lonely. Social isolation is very measurable, right? I mean, how often do you interact with other people? But either way, social connection can decrease the risk of heart attack by 29 to 32%. So again, if you notice that you don't interact with people often, and that is common, again, after the pandemic, how can you increase your reach, your outreach to people? And be sure to enlist help, right? Ask friends to check on you, or if you know someone who may be not interacting as much, how can you reach out to them and support them? So remember, each one teach one and each one support one. All right, sleep. So I think we got, you guys got most of these. Sleep. So what's the threshold? Everyone talks about 7 to 8 because that's kind of the ideal. But when you look at the studies, it's really when you dip to under 6 hours a night where you decrease your risk of heart disease by a great deal, and your heart disease mortality by a significant amount, 48%, right? So it's about getting that. The other factor that is very underappreciated and maybe not so known is that it has actually been shown that it is actually potentially more important that you get a window that doesn't shift very much between day and weekend. So there's this concept, I don't know if anyone's ever heard of it, called social jet lag. Has anyone ever heard of that? Social jet lag is this concept that you have a different, almost time zone between your work week and your weekend, whatever that might be, right? So you basically, maybe you go to sleep at 10 during the work week and you wake up at 5. But on the weekend, it's like 3 a.m. till, 1 p.m. the next day. So you have created this social jet lag where you have this significant gap between what your window for sleep looks like during your work week and what your window for sleep looks like on your off work time. So your social time. So it's that has been determined to be equally important. So if you're only getting 5 hours, if you're getting them in the same window, you are contributing. You could probably trade off on that. So again, look at your lifestyle and what's possible, but keep that in mind. So it's not just the duration, it's also, how is that being shifted across your for social jet lag. And if anyone has any questions, please feel free to put them in the chat. All right, the last thing is actually awareness, right? Because if you're not aware of some of these factors, you can't make the changes that you need, and you can't, if you don't know what your target is, right? You can't meet it. That's a given. When you know better, you can do better. That doesn't mean that you do, but you can. So education and lifestyle changes can really help prevent most cardiac and stroke events. I will say, so something was mentioned earlier that I didn't put on here, which was tobacco and alcohol, because those have been shown. The latest research around alcohol, there was, previously this idea that 2 glasses for men, 1 glass, or 1 serving, I should say, because everyone has a different glass size, was okay and potentially even beneficial of alcohol. The most recent research says moderation is actually still not great. So, social drinkers, that's fine. If you, what I tend to say is, if you're home by yourself, maybe have a little sparkling water. I understand the social aspect. That's how I even started drinking socially. And so, just think about what alcohol does. And tobacco is a well-known risk factor, smoking, for heart disease. Okay. All right. So what about some hidden lifestyle factors? Some other things that maybe are not thought about. And I'm gonna kind of bring these up because I had a friend who she's actually a naturopathic doctor, and she had said, she asked the question, how long can you go without air? And air is one of those things that it's top of the list, right? That's the thing that you really need. And what's interesting is air quality does play a role. So can you do something about that? Um, in your home, maybe in the private space, the indoor spaces that you're in, you may be able to get an air purifier. Outdoors, it's really a question of, if you live in a highly polluted area, there are usually pollution indexes. So you may want to pay attention to those and maybe not go outdoors, or be very careful. Masks are becoming more prevalent. And again, there's new research saying that maybe we should, kind of similar to other cultures, wear masks more frequently. So just keep in mind that air quality also plays a role. And then the second thing that my naturopathic doctor friend asked is, how long can you be without air? What's the next thing that the longer you're without, the higher your risk of health issues? And that's water. And I mean, water is kind of one of those things it's kind of common sense, right? Because what is your heart pumping? And that's, your blood, and your blood is mainly water. So staying adequately hydrated can lower the risk of developing heart failure by 20%. So those air and water factors, the things that we kind of take for granted sometimes, play a really, really important role in how our heart is working and how hard our heart has to work. So those are really important. All right. All right. So let's talk about the special considerations for women. Anybody have any ideas about things that are unique to women that may play a role in their understanding of their heart health potential risk? Any ideas? And all right, hormones, hormones. So when do hormones play a role? What stages for women? When do they play a role? Because that'll give you a good idea of, there's a couple of stages in life. In menopause, yes. So menopause is one of them. What's another stage where your hormones change? Puberty. Puberty is one. So puberty, thanks to the wonder of youth, is not one of those stages that create special considerations for heart health. But what's one other one that always gets kind of, I don't know, I guess it gets forgotten in terms of the fact that there are some significant hormonal changes. So, well, you said birth. I'm going to give you the other side of that. It's pregnancy, right? That is when you see significant changes in hormones for women. So I do want to talk about awareness first, because cardiovascular disease, as I mentioned, it has stagnated in terms of awareness of the fact that it kills more women than all forms of cancer combined. I mean, breast cancer gets a lot of attention, but again, cardiovascular disease is where we really need some support, and yet only 44%, right? We talked about half of the population, but 44% of women recognize that cardiovascular disease is their greatest health threat. So it's really, really important for us to think about for as women and as the women in our lives. Cardiovascular disease and pregnancy accounts for over a third of maternal deaths. So it is the number one killer of new moms. The US has a horrible track record, especially relative to other countries, with respect to maternal mortality. And this is one of the biggest parts of that. So it is really, really important that if you are pregnant, if someone you know is pregnant, that they're definitely getting tests, understanding what's happening with their blood pressure, with other conditions, gestational diabetes, all of those things. And then post-pregnancy. So what happens is actually what happens during pregnancy affects your risk for the rest of your life. So that's the reason why it's really important to focus on your health during pregnancy and then post as well. Right. So again, these are risky potential times. And then post-pregnancy, it can increase based on your pregnancy experience. So if you had eclampsia, preeclampsia, some of those pregnancy high blood pressure. Menopause, we've talked about that. It marks a point when the risk can increase. So again, increased focus on health and lifestyle can really be important during that time. And then this is something that when I found out, I was kind of, I was horrified, of course, as not only someone who practices CPR, but also as a woman, that I could be out there and I will be less likely to receive bystander CPR, right? Men have a 23% higher survival rate if they have a heart attack in public. And can anyone tell me the reasons why that might be the case? Why women are often less likely, to receive bystander CPR? And it's going to relate to our last special consideration. Any ideas? What do you have to do? If anyone's CPR trained, what do you have to do in order to administer CPR? What's the first thing, besides surveying the scene and asking to call 911? What do you have to do to the patient, if you will? Yes, you have to do chest compressions and rescue breaths. What do you have to do in order to do chest compressions? Giving you a little hint. You've got to take off clothing, right? So one of the things that has been reported is that people, particularly males, are afraid that they're going to be, it's going to be inappropriate behavior. So you will likely have to take off a bra. There's also this worry that because women are smaller, that there'll be some injury when, I mean, for those of you who are CPR trained, you know that injury is potential for anyone, because if you're doing chest compressions correctly, you may break a rib or two, but guess what? They'll be alive. The last thing that comes into play, unfortunately, is that people think that there is an emotional aspect to a woman passing out in public. That it is potentially, she's having an anxiety attack, a panic attack, that it's something emotional. And that happens more often, and because there is also a stereotype around men more often having heart attacks, that's not something that happens as often to women, when in fact that is not true. So I think that's really interesting to understand what goes through people's minds. And so again, this is about you all being aware, so that when if you're in, hope you're not, but those situations, you can help to act appropriately, or more appropriately. So all of those misconceptions play into the special considerations that lead to mis and underdiagnosis. So women and healthcare providers may not immediately associate symptoms, because women's symptoms are different. I'm not going to go into all of them, but those are available on the American Heart Association. A lot of it has to do with, it's not always that gripping chest pain that you see in the movies. And it could be pain in the back or neck. It could be nausea. And those symptoms tend to start to happen way before the heart attack. Some people say up to months before. So women, especially younger women, are more likely than men to develop a type of heart disease called coronary microvascular dysfunction. And what that means is it's in the smaller vessels. So, most of the common tests to determine if you had a heart attack test your aorta, test some of your larger arteries, when for women, the actual sort of clots or other can occur in the smaller blood vessels, and they're not picked up by standard tests. So again, I have a document, and I'm going to talk about that later. You can get access to all the resources that talks about what tests you might want to take if you feel like you're having symptoms, but nothing seems to be showing up in standard tests. And the last thing, high blood pressure is often underdiagnosed in women. So we're going to talk a little bit more about that. Any questions? So I just always like people to know about the special considerations. There are increasingly special considerations for children, as we see more high blood pressure in children than we ever have before. They said there's a statistic of about 3 to 5%. So again, right, things are changing such that we need to know and be aware of these things in order to be able to support the people that we love. All right, so let's talk a little bit about how you figure out, okay, what's going on with me? So hopefully you all know, so clearly blood pressure, that's the headline. What's your blood pressure? How is your blood pressure trending? That will tell you a lot about your risk of potential, your heart health generally. Okay, what does your blood pressure need to be? First number is systolic, last number is diastolic. What is a quote unquote normal blood pressure? And again, your blood pressure will be normal for you, and that may be a little lower if you're an athlete. But what number do you want to be on your blood pressure? All right, 120 over 80, yes. So 120 systolic, 80 diastolic. Do you know the difference between those two numbers? No? Okay. So systolic is the pressure when your heart is actually pumping. Diastolic is when it relaxes. So when it relaxes, that's when if you have a higher number on the diastolic, even if it's 120 on the systolic, if your heart is not relaxing sufficiently, so that's why anything over 90, even if it's 110 over 90, you want to start to look at that because that's when your heart should be relaxed. Okay. All right. So cholesterol. Cholesterol. There are two types of cholesterol, right? What are the two types of cholesterol? Does anybody know? What do you see when you get your cholesterol report? All right, so you have high density lipoprotein, your HDL, and you have the low, the LDL. And those are two different types of cholesterol molecules. And so you want to, your LDL is what the doctor typically looks at, right? And we want that to be as low as possible. Um, so typically your doctor wants it to be under 100. If you, again, have like a familial history, they may want it to be under 50. So again, you need to work with your healthcare provider to determine what should I be looking for, especially given my history and any other factors that you might have. Your HDL is a number that they want to be in a certain range and not low, I guess, I would say. So typically they want your HDL to be above 50. Okay. When it gets above 80, there's some question as to your cholesterol is still increasing. And your overall, the sum of those is desired to be under 200. And I'm going to talk a little bit more about, there's another test to understand a little bit more about what's going on there because HDL is typically referred to as good because they want it to be higher, and or at least the studies have shown that when it's within a certain range, you actually have, again, lower risk. And LDL lower, but there are other qualities of these that make them not so absolutely good or bad. The second two things, blood glucose, sometimes A1C to measure that. You should be measuring that regularly. A1C, blood glucose is kind of a moment in time. A1C is usually how much your blood glucose, the average over a couple of months. So that's why they typically measure A1C because it gives them a little bit of an overall number. So diabetes is related to heart disease. So you want to make sure that, and that's related to blood glucose. So that's something that you will have measured. And typically, again, that should be below 5.7 A1C, and with blood glucose directly less than 100. So again, I'm giving you a lot of information, and this stuff is in a separate document that you can give you access to. But these are things that you want to know. You want to know your numbers and what your numbers are and should be as you're maintaining your heart health, and see, hopefully, when you make changes to all those lifestyle factors, how they're changing for the best. So this last piece, there's a lot of talk about BMI. It has a lot of history, body mass index. Have people heard of body mass index? People talk about weight and BMI. As a coach, as a health and wellness coach, I don't like to talk about weight and BMI. One, because BMI is, and it has been confirmed, and that's where this body roundness index came from, is that it has been confirmed that it is an outdated measure, and it is not very accurate in terms of determining risk. It's based on weight and height. And according to the BMI, right, which has underweight, quote unquote, normal weight, overweight, and obese, The Rock, Dwayne Johnson, is morbidly obese. So that gives you a sense as to, it doesn't take into account body composition, which is critical for your health. And it just looks at how much do you weigh for your height, which is just a very basic measure. What they have found is that the body roundness index, which is actually height and waist size, and again, there's a sort of a range, is a much better indicator of heart risk. The body roundness index, the reason why waist size is important is because the visceral fat, which is what they call fat that accumulates around your waist in that organ region, is more related to heart health than in the hips and the rear and thighs. So there are different body types, which you've probably seen. And it is known that body types that tend to gain weight in that sort of lower region area, they're called gynoid body types, have less risk generally than people who are android, who gain weight in their midsection. So again, just something to know in terms of your relative risk and how important it is for you to focus on some of these factors. All right. So we are chugging along here. I'm going to try to stay on my time. So this is really important. When we talk about blood pressure measurement, what I was horrified knowing how important getting an accurate reading is. When I looked at, this is the American Medical Association. They actually have something for physicians. And again, this is a resource that I'm going to make available to you. How to measure accurately. I will guarantee you that most times at the doctors, there's something here that they don't do. And this is for you to advocate for yourself. If you want to measure at home, you should use the same guidelines. And there is a website called validatebp.org where they have validated, and this is a partnership with the American Medical Association, home measuring devices. So if you're going to buy something on Amazon or Walmart or whatever, please be sure to make sure that it's one of those that has been validated to be accurate. So that's one if you're measuring from home. But whether you're measuring from home or at the doctor, a couple things. No caffeine, exercise, or smoking 30 minutes prior. Right? That's going to help you obtain a BP that is accurate. It's more representative of a true BP. All the rest of these are also important to that. You should not talk. Talking or active listening, even if the nurse, physician's assistant or doctor is talking to you, can you ask them, let's wait until after this is done. That can add up to 10, so it can inflate your blood pressure by 10. Have your arm, your back, and your feet fully supported and your legs uncrossed. If they sit you down on the exam table, where most people, unless you're 7 feet tall, feet are dangling, ask them to sit in a chair. If the chair has no arms, ask them for a chair with arms. Your back, your arm, and so unsupported blood pressure arm can add up to 10. If there is no arm, they are supposed to support your arm. They're supposed to hold your arm. You're not supposed to hold your arm up. Unsupported back and feet can add 6 points. Crossed legs can add 2 to 8. Be sure that you empty your bladder. A full bladder can add another 10. And you should make sure if you have really large arms, ask them about other cuffs. If it feels like it gets too tight, it may be the wrong size cuff, and make sure that they're not doing it over clothing. Cuffs over clothing can add 5 to 50 points to your blood pressure. So it will be tremendously inaccurate potentially. And if it's a too small blood pressure cuff, but also a too large one, to be honest, any wrong size can add additional points. So how many people knew this stuff? Is there one thing here that maybe you didn't know? At least one thing here? Or if you think about the last time you had your blood pressure measured, how many of these did the doctor get right? Or whomever was measuring. I mean, I have to say, when I visit, I go to the doctor with my father, and I have had to intervene. They sit him on the exam table. They put it over his shirt, his long sleeve shirt, which gets all bunched up. And so you have to advocate for yourself. I mean, they're doing this so much, And again, it's a very interesting read, this guidelines for the doctor's offices, which again, I'll make it available. Okay, so last thing, what else can you screen for? So we've talked about cholesterol, and most doctors do a lot of the screenings that we talked about. Blood pressure, obviously, sometimes they measure wrong. Cholesterol, we're going to talk a little bit more about that. You do your A1C and your blood sugar, and then you also do, some measure of, again, you should look to do your BRI. So they'll measure your weight, but then you want to make sure you get a waist size measurement. You can ask them to do it. From the American Heart Association Journal, apolipoprotein B. So this is another lipoprotein. So LDL, HDL, those are all lipoproteins. ApoB, just remember ApoB if you can't remember anything else, has been identified as a more precise cardiovascular risk marker than LDL. Most doctors only look at LDL. This has just not been rolled out, but this has been something for the last couple of years that has been proven in research. So you should ask your doctor for an ApoB test. That will give you a much better understanding of your risk. These other tests help augment the picture of your risk. And so most doctors ask for a high sensitive C-reactive protein. I ask for a fractionated cholesterol. I mentioned earlier that HDL and LDL are not that simple. Fractionated cholesterol is a much more detailed view of those numbers. So it's fractionated, right? You see, oh, under HDL, I have different types of HDL. I have different types of LDL. And so not all types of HDL are good. So you want to understand that in more detail. And lipoprotein A is actually a genetic marker that will tell you again, sort of something about your genetics for risk. That is something that you can't likely change. Some of these other ones you can change with some of the lifestyle factors we talked about. But it is important to know because, again, you know if your risk is higher and how important some of those lifestyle factors are. But ApoB is my sort of exclamation point that I suggest that you ask for. If your doctor pushes back on giving you that test, this is my recommendation. So I'm also a board certified patient advocate. The phrase that I tell my clients is to say, what is the harm in doing it? Now, if the insurance doesn't cover it or something, okay, that's one thing. But to the doctor, it is no skin off their back to check another screen. And it helps you and them have better information about your risk and about what you should be focusing on. So that is my little, what's the downside? What's the negative side of this? Because I guarantee you they won't be able to give you one unless it's that you have to pay for it out of pocket. That would be one downside that they can't control. But other than that, and coverage should be coming because again, this has been very studied in research. All right. So do I provide a checklist? So I actually have a what I call my wellness check. So it actually has all of these things. And so you can go through and kind of figure out, and it has the summation of what the targets are for each of these things, et cetera. And I'm going to, again, I can send that to you because I have it in a Google Drive, which you can access all these documents, the AMA, blood pressure guide, all of this stuff. But I want you to think about what's one thing you can take away or do differently based on today's discussion. And one thing, again, not to create stress for you, if you're going to see the doctor, then maybe it's the ApoB, because if that's coming up in the next month, if you've got your annual that you start the year with, then, but if not, put it on your reminder list for later. What's one thing that you can take away or do differently? And you can put it in the chat if you like and share. I think that was not smoke before your blood pressure test. You can smoke, but just not half an hour before. Although, as you know, we mentioned that in the lifestyle factors. It is not overall a good thing. So thank you for sharing that. I just want you to really think about that and have something concrete in mind. Because as you think about these things, it can get very overwhelming. But let's within all of this stuff that I just told you, what's the one thing that you're going to pull out for today and say, you know what, I'm going to think about this week, this next month, this next year. Heck, if you focus on one thing with the lifestyle factors for 2025. All right, so more accurate BP reading. So yes, you know you're going to get that measured. So just have those things in mind. Learn more about family heart health history. Yes, this age of 50. That is the easy thing. That's a nice, your parents will be glad to hear from you. That's a nice call to somebody to say, hey, did we ever have any? It's a great way to have a conversation. And there's a tool that I can point you to help you sort of gather that information, because I will say that the tool gathers heart, sort of any heart history, as well as cancer, because cancer also has the same sort of threshold. Has anyone been diagnosed with cancer before 50? Then you need to understand how that may affect your risk. All right. So if you have any questions, feel free to email me at Tanya@embodywell.com. If you would like to talk about, you're really concerned, or you just are really excited about doing some changes for your lifestyle, please feel free to schedule a consultation. We can talk about where you are, where you want to be, and maybe how I can help, at calendly.com/embodywell. And if you want access to the heart health resource folder, send me a message at Tanya@embodywell.com and I can get that out to you. And you can have these things at your fingertips, so that you can, kind of continue to review these and keep them in mind. And with that, that's the fire hose. I have, it was a really thick hose because there was a lot of information there. But it is, again, our why heart health. I hope you keep that in mind. Again, it is the number one killer, and there is a very sort of concerning lack of awareness that I just wanted to start the year with, starting out some folks, and hopefully the folks who will watch the recording, to share this information. Whatever you've decided to pull out of this, share that with someone else and maybe encourage them, and hopefully encourage them to, again, each one teach one. So thank you. I did get a couple of emails there, and I will send that info out. Thank you, thank you, thank you. If you have any questions, I'll stay after, but we're going to stop the recording now.